This video is for educational and reflective purposes only. It is not intended to diagnose, treat, or replace professional medical advice. If you have concerns about your health or the health of someone you know, consult a qualified healthcare professional. The face is the mirror of the mind, and eyes without speaking confess the secrets of the heart. St. Jerome, for most of us, a smile happens without thought, a laugh, a raised eyebrow, a simple expression of joy. But for a small number of people around the world, those expressions may never appear. This is the reality of Moebius Syndrome. Imagine feeling happiness, finding something funny, or looking at someone you love. Yet your face remains completely still. People may assume you're angry, emotionless, or uninterested. But inside, your emotions are just as vivid as anyone else's. This is one of the greatest challenges faced by individuals living with Moebius syndrome. Moebius syndrome is an extremely rare neurological condition present from birth. It primarily affects the 6th and 7th cranial nerves. These nerves control many of the muscles responsible for facial expressions, smiling, blinking eye movement. Because these nerves develop differently, facial paralysis is often present from infancy. The condition affects facial movement, not emotional experience. Researchers believe Moebius syndrome develops very early during fetal development. The exact cause is not always known. In some individuals, changes in blood supply during early pregnancy or rare genetic factors may contribute to the abnormal development of specific cranial nerves. Scientists continue investigating why these delicate neurological pathways sometimes form differently. Symptoms vary from person to person. They may include limited or absent facial expressions, difficulty smiling, difficulty blinking, limited side-to-side eye movement, feeding difficulties during infancy, speech differences. Some individuals may also experience limb or skeletal differences. Despite these physical challenges, intelligence is usually unaffected. One of the greatest difficulties is not always physical, it is social. Humans naturally read facial expressions to understand emotions. When a face cannot easily communicate those emotions, misunderstandings often follow. A person may feel joy, kindness, or excitement, while others mistakenly perceive indifference. Diagnosis usually begins during infancy. Doctors evaluate facial movement, eye movement, medical history, physical examination, additional neurological assessments, and imaging studies may help rule out other conditions. Early intervention can improve feeding, speech, and developmental support. There is currently no cure for Moebius syndrome. Treatment focuses on improving quality of life. Depending on individual needs, care may include physical therapy, speech therapy, occupational therapy, eye protection, specialized surgical procedures, including smile surgery. In selected cases, treatment is highly individualized. Medical researchers continue studying cranial nerve development and innovative reconstructive techniques. Advances in microsurgery, rehabilitation, and multidisciplinary care continue improving long-term outcomes for many individuals living with Moebius syndrome. Each discovery helps physicians better understand how facial movement develops. From a symbolic perspective, Moebius syndrome invites us to ask an important question. How often do we mistake expression for emotion? A smile can communicate happiness, but happiness does not depend upon a smile. Sometimes the richest emotions remain completely invisible. Perhaps the heart has always spoken a language far deeper than the face. Human communication extends beyond muscles. Compassion is found in actions. Kindness is found in choices. Love is found in presence. The absence of an expression does not mean the absence of feeling. Sometimes, what we cannot see is the most important part of another person's experience. Moebius Syndrome reminds us that appearance is not always a reliable guide to reality. Behind every still face, there may be laughter, hope, fear, dreams, or profound love. Understanding begins when we listen beyond appearances and choose empathy over assumption. Moebius Syndrome teaches us that the human face is only one way emotions are expressed. True connection begins when we look beyond appearances and recognize the person behind them. Every rare condition expands our understanding of what it means to be human. If you enjoy exploring rare diseases, extraordinary medical mysteries, and the remarkable science of the human body and mind, don't forget to like this video and subscribe for more cinematic journeys into the hidden wonders of medicine.